Giving medications to birds is challenging for owners. While most birds will never require medications, those that do often need to take medications by mouth, often once or 2 times per day. Catching and restraining a bird and forcing oral medications is stressful for both birds and owners. Many birds can be taught to take liquids from syringes long before medicine is even needed, making the whole process more pleasant and less stressful. Determine your bird's very favorite treat reward, which should be very small, like a piece of nut. The object is to get the bird to touch a medication syringe with his beak and eventually take liquids from the syringe, all in exchange for a food reward. Acclimate the bird to the medication syringe until the bird is curious about it, but not fearful. Hold the syringe nearby and wait for the bird to investigate it and touch it with his beak. Say "good bird" and immediately give the food reward. Try this a few times per session, once daily. Once the bird knows to touch the syringe for a food reward and is willing to do so consistently, introduce a drop of water from the syringe. Work calmly and consistently towards the goal of getting your bird to accept the syringe full of water in exchange for a treat. Repeat this regularly so that your bird does not forget. When it's time to give medication, use the same technique, a little bit at a time, all in exchange for a treat. Keep in mind some birds that need medication might not feel well enough to want a treat. In these cases, restraint might be necessary, especially if your bird is very ill. But don't forget to practice so you're ready in the event your bird needs to take medication.